Today we're gonna go over anterior knee pain. I feel like a lot of us have dealt with it, where it's like underneath our kneecap, below the knee, which would be our patellar tendon, above the knee is our quad tendon. A lot of this, it starts from one of two areas, typically from this quad being really tight. For all of us that sit all day, everything gets shortened from being in this position. So we're gonna work to basically take tension off of this quad and off the kneecap to give it a little room to breathe. If we look at our anatomy chart, we'll see that we have fibers of like our fascial system that actually wrap in from the top as well as from the bottom. So we're going to work on addressing above the knee and below it to make sure we get a full kind of scope of clearing this up. So first thing we're going to do is take a lacrosse ball. We're going to use this a little different than usual. Normally use it as a soft tissue tool to actually put pressure in. This time we're going to use the tack of the rubber to put pressure into the skin, and we're going to work to actually pull the skin, is what it's going to feel like, pulling the skin away from the knee. So we're really trying to improve those sliding surfaces. When I talk about sliding surfaces, I'm referring to the interaction between skin, fascia, and muscle. So kind of working here, we can do this for 20 to 30 reps above. Then we're going to go below the knee and we're going to do the same thing, putting that pressure in, pulling away from the knee and from the kneecap. There's no right or wrong here. If you get onto a spot that's like tender, like hey, it doesn't feel good, because it is really bony around the joint, you could avoid those areas. Normally not too bad, not too sensitive, but we're going to work through that. Once we've kind of freed up a little bit of the soft tissue, immediately touching that, we're going to look to lengthen some of the muscle. So some sort of pad's always great when we get into something called the couch stretch, which we're about to get into. So staying on this left side, just for the sake of being consistent, this foot's going to go up on a wall, a box, and then we're going to drop our knee onto that pad. I have a foam roller here for balance, just to make it a little bit easier. So from here, how I talked about sitting, where that knee was up, the leg was bent, we're going to do the opposite of that. So this hip now, we're working to get into extension, so get that knee almost behind us. And if we kind of just hang out and I can relax into it, there's not much of a stretch to this quad. The way we increase that stretch by turning on our glute, so squeeze this glute to push the pelvis forward. From there, if you want to glide the hips forward to increase that stretch, go for it. But we're looking to hold this for 60 seconds on each side. You'll really feel a pull here. You might feel it down at the knee if the knee is really achy. That's fine. You're not going to do any damage here, but we're just looking to accumulate that 60 seconds and get a big stretch and get all that tension off there. So after those two, where we look to basically pull tension away from that from the soft tissue standpoint, really lengthen the quad, get length through there. We have two movements, and one is going to be a scaled variation of them. We have the terminal knee extension with a band, and then we'll go into a split squat with dumbbells, trying to really load into extension again. So looking at the terminal knee extension with a band, we're going to go our foot inside the band, strapped onto something stable. Here I have a post. We're going to go foot inside the band, goes directly behind the knee, and we're going to back up until we get some tension on that band. What that's going to want to do, and I'm fine with it for the sake of this, is pull this heel off the ground and let our knee bend. This is going to be our relaxed position in the pose. And then we're going to really work on firing this quad to come back into extension. You should feel good activation. After loosening up the front of the quad, this shouldn't be nearly as tender on the knee, but we do need to get some form of that quad firing to start to work on like repatterning and regrooving how that kneecap kind of glides in between what's called the femoral condyles on the femur that sits behind it. So working through this, roughly 1 to 2 sets, 15 to 20 reps, depending on how that feels for you. Next, going into what I was saying earlier, that like loaded lunge position, trying to still work into extension of the hip. I like to grab dumbbells. So we could do it without dumbbells, but having dumbbells pulls us deeper into that lunge. So the knee that we're working on, I'm going to show my left here, we get wide in this lunge. From here, it's the same as that couch stretch, where I want to squeeze that glute of the leg that's behind me to tuck my pelvis underneath and make my torso upright. We could sink down a little bit. And if we're really squeezing, we'll feel a stretch here in the front of the hip. It's exactly what I'm looking for. That quad attaches on the top of the knee, all goes all the way up in the front of the hip. So we're still going after the same muscle group, but spending time here. This isometric will really start to create some length and pull some tension off that. So ideally 2 to 3 sets of 30-second holds there. We'll work on basically clearing up this quad, taking pressure off the knee, and alleviating some of that pain that we're dealing with behind the kneecap.